Good morning, and welcome to the Brenda Perryman Show right here on TV 33, WHPR, Comcast 91 in Detroit, and all over the world, courtesy of the World Wide Web. It's on an app. You can find us everywhere, and I have a great show for you this morning. But first and foremost, I would like to extend my sympathies and the sympathies of everyone here at WHPR to the Lindsay Porter family. Lindsay Porter was mayor of Highland Park from 1991 to 2003, and I've known Lindsay since 1969 when I was a student teacher. I was just 21. I think he was a senior at that time at Highland Park High School, and he used to tease me all the time. So I've known him for 50 years, and God rest his soul. And once again, I said sympathies to the family. And TV 33 will be airing some of the funeral live at 10:30. So, my first guest, and I want you to stay tuned for my second guest too, because she has brought a lot of goods. I love when she comes to the show. We have Zaina from Spectacles, and my first guest is Nina Abu Bakari, who is the CEO of Advantage Health Centers. Good morning.
Good morning. Thanks for having me.
Oh, I'm excited to have you. Healthcare, how important is that?
It's extremely important, and I want to stress that although we are about the business of healthcare, we are also about the business of health. And so not necessarily coming into our centers, we still want to promote health to the community, whether you're a patient or not.
Preventative.
Absolutely.
Yes,
Preventive
preventative.
health. Preventive health.
And Nina, don't mind me calling
you can call me Nina. That's great.
You can call me Nina. Nina, let's get a little background on you.
Sure.
Where are you from originally?
Yep, I'm born and raised in Detroit.
Yay!
Yes, on the west side.
West side.
Absolutely. Went to a number of different elementary schools and middle schools, but went to Renaissance High School.
Oh, did you?
Absolutely.
Great school.
Absolutely.
Great school.
And then went to University of Michigan undergrad, majored in biology and women's health. Women's studies, focusing in women's health. Originally thought I was going to be an OBGYN, but ended up coming back to Detroit and pursuing several other degrees and focusing on health administration.
Oh, great.
And so I also have a law degree and a business degree from Wayne State. Yeah.
I love it because we as women are so multifaceted.
Absolutely.
We change caps.
Absolutely.
We change jackets for so many different things.
Yeah.
And law.
Yeah.
Why did you decide to go into that also?
Well, public health is a very multifaceted type of industry. And so originally having a master's in public health and epidemiology, I could study diseases, which was great for me, and I loved it. Yes. But really fitting a business case to healthcare and knowing that there's a cost to it and really understanding that helped me to, promoted me to get an MBA in finance. Okay. But at the time, I was working at Sinai Grace Hospital, and there were a number of leaders there, particularly the CEO at the time.
Oh, you're talking about
Conrad Mallett Jr.
Oh, okay.
Yeah, and being originally a lawyer and then the first Black Michigan Supreme Court justice, I was promoted into healthcare and from a legal perspective, and really wanted to be interested in
that is very important. That
absolutely.
Legal perspective with healthcare.
Absolutely.
Because things happen.
They do, and that was right before the ACA passed, the Affordable Care Act. And so I was like, I really want to kind of understand what this means for healthcare and how it's going to impact our communities. And so I went back to Wayne State to get my law degree.
Excellent.
Yeah.
Excellent. Excellent. So as you see, she's very, very well qualified for what she is doing. And, healthcare is on the forefront of everybody's mind these days.
It is.
Whether it's preventative health care, which some people, like you say, wait too late.
We do. We wait too late, and then what the cure is almost as catastrophic as the disease, right? And
Yes.
so preventive health care is always going to be, I think, primary, certainly for the things that we want to promote at our clinics, in that we are offering medical, dental, and behavioral health care.
That's what I saw.
Yeah.
And we're going to break all that down.
Yeah.
I was really excited about that. I said, it's not only medical, I said dental.
Yes. Absolutely.
So tell us a little about Advantage Healthcare, Advantage Health Centers.
Yes.
I'm sorry.
Yes, that's
I
fine.
keep on having healthcare on the mind.
Yeah.
And then there's so many things with these candidates who are running for office talking about health care. And I have a big concern about one of the, I'm going to just kind of start off with that.
Sure.
Bernie Sanders says Medicare for all, you could just get rid of your health care, the private health care that you have, and everybody just do this one thing. And I have an issue with that.
Well, there's pros and cons to both. And I'll say that there are some countries outside of the United States, of course, obviously, that are pursuing universal health care, that are doing it successfully. The Americans have not the best health care and not the best health. Right? And so if you look at just one issue, like infant mortality, even in the city of Detroit, is extremely high.
I know.
There are some third world countries that have better infant mortality than we do. And so it's really a question of...
You mean lower in...
lower, better, meaning lower,
Lower
infant mortality than Detroit does. And so the question is, are we as health professionals and as a healthcare industry, whether it be insurance or the infrastructure and so forth, are we providing the care that's going to make people better? And if we're not starting with preventive care and we're using insurance or ability to pay as a barrier to folks getting health care, that will always be an issue for us.
Yes.
And so we attempt to address that at Advantage Health Centers. We have a sliding scale fee, and so if you don't have insurance, if you have proof of income, we can have you pay a nominal fee for your services. We are not a free clinic, but we do adjust what you pay based on your income.
That is amazing.
Absolutely. We sign people up for insurance. Some people may not have insurance. We address the homeless population who may not even have a home address. We provide all of those services. We are what's called a federally qualified health center, which means that we get a higher Medicaid payment rate than maybe a private physician.
Really?
Absolutely. And so where there are primary physicians or primary care physicians who are leaving neighborhoods, we're rushing in to make sure that those communities have access to health care.
Very important.
Absolutely.
Very important. Now, what about those people who may have Medicare and Blue Cross Blue Shield?
You can still come. We take care of folks who have the best insurance all the way down to folks who have no insurance. So we take care of the spectrum of folks. And so you can, again, if you don't have insurance, we can help sign you up for insurance.
So how do you do that? I mean, you help them sign up for what?
Right.
Is it the ACA?
The ACA.
Okay.
There's a Medicaid plan here for the state of Michigan.
Yes.
So we help folks sign up for all of that. Absolutely.
Medicaid, let's talk about that
Sure.
real quick. How do you, if somebody comes in, they may not know that they're qualified for Medicaid,
Yeah.
correct?
Right.
So through your process of having them fill out the paperwork,
Yes.
you find out things also.
We do. And so we have folks, community health workers and outreach workers who are trained in how to sign people up for insurance and ask all the questions and get all the information in so that folks can qualify for insurance or determine if they do or they don't and what their options are.
Okay, well, with the ACA, which some people call Obamacare, and I don't call it.
I don't either.
Some of the cousins call it
Yeah, they
Obamacare
do.
too, because
They
last
do.
week I just saw a cousin of my son-in-law, and he said, "Well, I have Obamacare,"
Yeah,
you know.
yeah,
So,
yeah, that's what they call it.
okay, but I've had people complain too, saying my rates are too high for Obamacare. I mean, the ACA,
Yeah.
Affordable Care Act, everybody.
right,
Because
right.
I interviewed Valerie Jarrett about that prior to it going into effect.
Yeah.
And I always kind of misunderstood some of it. I think a lot of us don't understand
Yeah.
because at first I said, "Oh, this is really good," and of course I want it to be great.
Right.
And then I was in the deli one day, and the lady behind the counter said, "Well, I have it, and I'm paying so much money," and I don't understand how does the Affordable Care Act, and we know that there are things that need to be improved, but it
Absolutely.
shouldn't be wiped out.
It should not be wiped out. I think it does need to be improved, and I won't sit here and act like I'm a healthcare insurance expert.
Right, right.
But there, again, are folks at our clinics that can help folks navigate what that looks like. And I have heard complaints that it's too high, but I also have people blessing that they now have
See,
insurance
and
who haven't had it. So.
I know several people who have it, and they're happy to have it.
Absolutely.
Really?
Absolutely.
So, Advantage Health Centers. Now, didn't you just open up a new space?
We did.
Why don't you tell the
I'm
audience
so
about
excited to talk about this. This is Advantage Health Centers of Hope Village. It's at 1355 Oakman in the Hope Village neighborhood.
Right.
And we are super excited to be able to open up that building, which used to be the Focus Hope headquarters. So we
Yes.
are following in that
that?
building
So
on
that's what it used to be.
yeah, so it's 19,000 square feet of space.
Yeah, right.
We've built out the first floor to provide medical, dental, and behavioral health services. We also offer OBGYN services.
Okay.
We offer telepsychiatry. We offer all these different things, as well as enabling services to, again, help people sign up for insurance. And so what we really try to promote at all of our sites, and there's a total of 5, all of them are in Detroit with the exception of one, which is on actually off of 8 Mile and Ryan, which is in the city of Warren, our family site. But we are really trying to promote integrated care. And so what that means is that although we know a lot of our folks are coming in for medical, we know that a lot of our folks are requesting dental. And so we want to make sure that if you're a medical patient, we ask you, do you have dental services? And if you don't, we try to connect you with that so that you can get everything done in the same place.
Well, because dental services are very important because
Absolutely.
that's important to your overall health.
It is, and so we're looking at some of the research that's talking about, again, infant mortality and low birth weight babies, and trying to connect the fact that a lot of our OBGYN patients are new mothers or would-be mothers have dental issues that might contribute to the infant mortality, and then therefore the low birth weight babies and then infant mortality. So we're connecting the dots between the fact that these things are connected in a way that causes other things to exacerbate. So for a lot of our patients who have diabetes, they also have depression, which is highly associated with a lot of different chronic diseases.
Yes.
So we try to connect the dots and make sure we address all those major concerns.
Well, I want to go back to the building.
Yeah.
You say the first floor is all
It's all built out. And so we maintain the community room, and we want to continue to use that for educational purposes. That site has probably more technology than any of our other sites. There's an internal billboard. There's a computer for a kiosk for you to check in quickly so that they can just know that you're here and call you to the back and get you seen as quickly as possible.
That building has several floors.
It does. There's a second floor and a third floor mezzanine. Those aren't built out yet. And so
Okay.
we're looking to see what the community response is to determine how we build out the rest of that building. So we
Okay.
got room to grow, which is
Yeah,
great.
well, that's great because, okay, so that bottom floor, we come in, we check in
Yes.
at the kiosk.
Yes.
And then somebody probably calls us.
Yeah.
And then they see what we have, or do we start filling out our information?
You can fill that out before you get there.
Okay.
All that information is online. There's a patient portal, just like any other primary care service. We
Yes.
don't want folks in the city of Detroit or anywhere else that comes to Advantage to feel like they're getting less of a service. So we're making sure that anything you can get in the suburbs, you can get right here in the city with Advantage Health Centers.
So let's go to medical first.
Yeah.
So can you get have an internist there?
We have family medicine,
Family medicine?
providers, absolutely, and
Okay.
internal medicine.
Okay.
Yeah.
So this doctor or doctor
Yeah.
there can become your family
That
doctor.
would be your primary care physician.
right,
Absolutely.
right.
We also offer pediatric care.
Oh, wonderful.
Absolutely. So folks can bring their families, right, and not just come themselves and feel like they have to go somewhere else for their kids or go somewhere else when they're pregnant. We want to make sure that we are a one-stop shop. And so in order to get started, you can either call the appointment number, which is 313-416-6262. Let me say that again
Let's
slowly.
say it again. Nice and slow.
313-416-6262 is the phone number. Or you can go to the website and get more information on all the sites and information about
Advantage
what we
Health
do.
Centers.
Absolutely. ahcdetroit.org.
I just got it with Advantage Health
You can put
Centers.
that in too.
Yes.
Yeah.
It's
yeah.
such a wonderful site. It's
Yeah.
very well informed. I mean, you learn so much just on the site
Yeah.
itself.
Yeah.
And it's an inviting site too.
Thank you. Thank you.
And okay, so we can come there now, like you said, pregnant or almost pregnant.
yeah.
Or,
Kids and anticipating pregnancy.
anticipating.
Yeah, absolutely.
Right.
Absolutely.
So I could come. I could come.
Anybody can come.
Yes.
Yeah.
And they can have
a physical done. They can
a
get
gynecologist.
Absolutely. They can get all of their annual checkups done. We do immunizations, all of that.
I was going to ask you, do you do mammograms?
We do not do mammograms on site.
Now, do you have a place that you?
Yes, we refer out mammograms.
Okay, that's
Absolutely.
what I was going to ask. Very, very important.
Absolutely, especially in our communities,
Yes.
right? And so we do a number of different things around chronic diseases, especially for screening for cancer. So not just focusing and promoting mammography, but also cervical cancer screening, colorectal
Yes.
cancer screening. All of that are what you get from your primary care
What
physician.
about
That's
prostate
what we do.
exams?
We have male physicians and nurses who can conduct that and
Oh, great.
refer that out.
That's great, because that's something that's
Absolutely.
very, prostate cancer is prevalent in our community.
Absolutely, absolutely. And so again, as public health professionals, we're not just looking at what the patient has in front of us or what they think they have, right? We're looking at our communities and making sure that we address the community concerns and know that in some of our zip codes in Detroit, we have some of the highest diabetes rates in the country. So we want to address that. And we want to focus on making sure that we educate the community about those chronic diseases.
That's what I was going to ask. You were talking about the community room.
Yeah.
And I was thinking about classes for diabetics
Yes.
and things like that.
Yeah, and that's on a monthly basis.
Excellent.
So we just had a
excellent.
class last Friday on the 21st
Excellent.
at that site, 1355 Oakman, focused on diabetes.
Because a lot of people aren't aware. First and foremost, they're not aware that they have diabetes sometime until they have it.
Right, right. And sometimes not even then, right? We're still waiting to go to the doctor because we don't want to know what's going on. But I'll suggest to you, and as I've said to many other people, our issue is diabetes, and that's clear. But I think the larger issue are those who are pre-diabetic.
Yes.
So again, going back to the preventive care, we want to make sure that we're addressing those who are on their way to being diabetic.
Yes.
Because we can make more intervention with those folks. Certainly when you get diabetes, we're going to address it and try to help you manage it appropriately. But if you have pre-diabetes, let's get to you then so that we can address
Absolutely.
those concerns so you don't cross over to being
There's a
diabetic.
question I have to ask about that, because I know of some people who were diabetics
Mm-hmm.
and they started doing everything right.
Yeah,
And
they
they
reversed
started
it.
coming off their medicine.
Yeah, that's extremely important. And so that goes along with managing the disease, right?
Right.
So that would be great if a lot of folks could go that way and
See, and a lot
become
of
not
people
diabetic.
think it's just not, I just won't have sugar. But
Yeah.
sugar is in so many
It
things. It's in
is.
bread.
It
It's
is.
in, carbs.
It's in ketchup.
Yes,
You know?
I know. I love ketchup.
I know, I do too.
Heinz is my favorite.
Mine too.
Unfortunately, I have a nerve to be choosy about my ketchup.
Yeah,
you
ketchup
know.
is important to me too. And I think though that as we continue to educate the community about how to cook, what ingredients to use. You know, I'm a big advocate of, if you're eating fruit, make sure it has seeds. I'm not a fan of seedless watermelon. You got to know,
really?
absolutely not.
Oh, you're kidding.
No,
Oh, no.
Fruit is defined by seeds, right? And so all these different things that we know as from a healthcare perspective, again, we're not just about healthcare. We're about the health of the community. So again, whether or not you come to us as a patient, we want to make sure that you have the information that you need to keep yourself and your family healthy. So we make sure that we educate the community. Absolutely.
Right. Now I'm going to get into the behavioral
Yeah.
services
Yeah.
that you all have.
Absolutely.
And that's very, very important. Mental health.
Mm-hmm.
And remember, in our community, there's a stigma
Yes.
associated with it.
Yeah.
So tell me about the services there.
So we do a number of things, regardless of if you come in specifically as a mental health patient. Like you said, there's a stigma associated with that. But we screen folks for depression at every visit. And so
Really? How do you
absolutely,
do that?
there's a screening tool that they use. And again, I'm not a mental health professional,
Right.
but there's a screening tool that they use, the PHQ-2 and the PHQ-9, to address some immediate concerns that patients may have. But I'll tell you this, once you get used to answering those questions, if you don't want people to know that you're depressed, you'll answer them in a specific way, right? And so it's going to take, I think, certainly in our communities, more discussion about mental health, and we're attempting to do that as well. We have a number of community sessions or group sessions. We address those types of concerns where people might feel some level of stigma talking about it individually. They might feel comfortable if there are more folks around the table that have the same issues, right? And so they have a number of different sessions where community folks can come in, our patients can come in and talk about their different mental health issues. We also have telepsychiatry. There's a number of our patients.
What is telepsychiatry?
Well, it's psychiatry, but it's over a computer screen. So you're dealing with the same type of psychiatrist instead of being face-to-face. We make sure that you are able to get your needs addressed from a screen with the same psychologist being there. We have
Wow.
a shortage of, I think, certainly, I believe mental health professionals, but certainly psychiatrists in this market.
Yes.
And so we make sure that we can have access to psychiatrists for our patients by doing telepsychiatry, which is extremely important because now you're in the realm of having meds prescribed to you due to your mental illness. And so we want to make sure that our folks have access to that.
And I know you're not a doctor.
Yeah.
But what we hear about a lot now is bipolar disorder. And that's something that a lot of people, some people recognize it in people. Once you read all of the information about it, and you watch a person's behavior
Yeah.
over a certain period of time,
Yeah.
and trying to get that person to realize that they need some help.
Yeah.
And that's especially hard for families.
It is, and I will suggest that although there are issues of severe mental illness and issues of bipolar, and we can go on down the list of mental health diseases. When we're talking about mental health, the average person, the person who does not have one of those extreme diseases,
right.
may deal with issues of simply stress.
Stress
Right.
and depression.
Yeah.
Those are very high.
And
a
they
lot
might be episodic.
And a lot of times people don't know they're depressed.
Exactly. And don't know they're stressed.
A lot of people think, right. Well, no,
Right.
I.
As well.
But you
Yeah.
know, what's so important too is the fact that depression isn't always you're feeling down like
Yeah,
that.
yeah.
There a lot of ways depression can manifest itself in many different ways.
It can, and so we have to be cognizant of that, as it relates to how we take care of our bodies. Right? It may not be that you have diabetes and you feel depressed because of that. It may be that you're in a community that is not supportive of you, or that you're stressed at your job, and that will prevent you from seeking just normal, regular, annual visit care, right, from your primary care physician, because you got other stuff to deal with. So you put yourself last, and then
All the time,
stuff happens.
especially mothers.
Yeah, absolutely.
Especially mothers.
Absolutely.
And wives.
Yeah.
They put the whole family goes first.
Yeah, and so what we find, though, is that women are the center of healthcare in their families. They're the ones that, if they're taking care of themselves, and they're taking care of their kids or their spouse or their partner and so forth, they are the ones that are the drivers of healthcare in their household. And so certainly we want to promote our services to women, to make sure we get them in and get them taken care of. But we also want to make sure that our men come in. And so we're trying to make sure that we have all of the services that men need, so they can get their needs addressed as well, whether it be medical, dental, or behavioral
And
health.
with men, they tend to wait.
Yeah.
Wait.
Yeah. And it might be that there's not a male provider that they want to see, right? And so we
well-
address that need as well.
Well, it's not a male provider. Sometimes I don't want to know.
Right, I don't
You
wanna know.
I don't want to know.
I'm already stressed.
I'll get over it. We'll take some aspirin or
Yeah.
something and we'll get over it.
Yeah.
But a lot of times you're waiting too long.
Exactly right.
And it's
Exactly right.
important that you just check it out. Just go and find out.
Absolutely. And you can call Advantage, and I'll say the number again.
Say the number.
It's
again.
313-416-6262, or you can go to the website ahcdetroit.org.
Now, on the website, can you start filling out paperwork?
The new patient paperwork is online, and you can find it there. You can print it off, fill it out, and bring it in when you
That
come
would be
in.
great.
Yeah,
That
so you
would be
can,
great.
when you get there, you don't have to worry about doing all that stuff then. You can do it early.
And you should call for an appointment.
You should. You
Right,
should.
absolutely. And, okay, there's one on Oakman over in the Focus Hope area.
Yes, it's 1355 Oakman. There's another one on 6 Mile and Greenfield, our Thea Bowman location.
Okay, 6
Our-
Mile and Greenfield. I
Yeah,
was
6
just
Mile and
thinking-
Greenfield.
Uh-huh.
There is the Waller location.
Okay.
As well.
No, I'm looking at 6 Mile and Greenfield. because
yeah, it's right on the corner.
Drove past there last night, because
Yeah.
there's a Burger King on one corner.
There's a McDonald's.
McDonald's, I
Yeah.
knew it was something like that.
There's a Coney Island, a gas station. It's in that heart of that neighborhood over
right.
there.
That's a great neighborhood to
It
have
is.
that in.
It
Yeah.
is. Santa Grace Hospital is a couple blocks
Right.
away, and so forth. So that's my stomping ground. So Renaissance High School and all that is over there. So I've been in that area for many, many years. But again, the Waller site is off of Woodward and Warren. John Waller was our founder.
Oh, okay.
Yes, so he started us as Detroit Healthcare for the Homeless back in 1986. So we've had a long history of being here in the city and really promoting services to, again, our homeless folks, as well as everybody who has up to no insurance, up to the best insurance. And so we're addressing the needs of all of our community and making sure they get the best health care we can provide.
And I'm really impressed with the fact that you all look at people's incomes.
Yeah, absolutely. Again, I'll stress, we are not a free clinic.
I know.
But we do offer our services with this sliding scale fee, which you would pay a nominal fee based on your income.
Absolutely. One last question.
Sure.
Geriatric services.
Yes. Yeah. So we have, again, our primary care services are for the scope of the family. So from pediatrics all the way up to geriatrics. Absolutely.
Oh, great,
Yeah.
great. Because, the baby boomers are big now.
They are, and they're demanding health care.
Yes,
They're
yes.
demanding services, and so we're here to provide that for them. And I'll stress again, we have 5 sites, and we're trying to place ourselves all across the city. Again, the 1355 Oakman site, the 15400 McNichol site is our Thea Bowman site. The Waller site is on Woodward and Warren. Our Children's Dental Center, we focus on children's dental care, is off of Woodward and Alexandrine.
Yes.
And then I got 4 sites, 1, 2, 3. I said the Focus Hope site, the Family site, the Thea Bowman site, the CDC site, and I'm missing one, but all of that information is on the website. You can find
Right,
that.
it's online. It's
It
very,
is.
like I said, a very good website.
Mm-hmm.
Very good. Well, thank you so much for coming to talk to us about this.
Thank you for having me. I'm excited to talk about it. I always say that I don't got to do this work, I get to do this work. I'm so
Yes.
excited to be in my hometown providing care for our community.
Wonderful. You heard it here first. Say that phone number one more time.
That phone number is 313-416-6262, and the website is ahcdetroit.org.
Or Advantage Health Centers,
Yes.
if you forget those letters.
Yes.
So I will be back in just a moment with Zaina.
WHPR TV is now on Channel 90. Check out all of your favorite morning talk shows on Comcast Channel 90 every day from 7 a.m. to 12 noon, and watch us anytime, day or night, on all of your favorite devices. Download the WHPR TV Now app and take us with you wherever you go. WHPR TV is now on Comcast Channel 90 every day from 7 a.m. till noon. WHPR TV, a Watkins Broadcasting Company. Now you can watch WHPR TV 33 on Fire Stick. Catch all of your favorites. Stay informed. Don't miss a minute of your favorite talk shows. Call, text, tweet, post. WHPR TV 33 is worldwide on Fire Stick. For more information, go to FirestickTVNetwork.com or call us at 313-868-6612. WHPR TV 33, a Watkins Broadcasting Company.
I am back with one of my favorite people, one of my favorite entrepreneurs, Zaina from Spectacles. Good morning.
Good morning, Brenda.
Oh, I love how your voice just carries. You should be a speaker.
I wouldn't mind that.
Yes, yes. A plethora of things. Zaina, first tell them where you're located.
Okay, we're located in downtown Detroit, Brenda. Spectacles is an icon store right in Harmony Park, or some people are calling it Paradise Valley.
Yeah.
We're like sandwiched between the music hall and the new YMCA building.
Yeah.
Not too far from the Shinola Hotel.
Right.
Yeah.
Golly.
Right there at Broadway and East Grand
You
River.
have seen that area go through changes, haven't you?
It's been quite interesting.
To say the least.
Yeah, to say the least. All the well, we've got a lot of pets now in downtown Detroit. People are walking their dogs and jogging, and it's very interesting. Things have really changed.
Why do you think that is?
More money, more money, more money.
Yes, all about
It's coming downtown, you know.
Yes, yes.
It's remarkable what they've done with downtown Detroit.
And I'm glad you're able to stay there.
I've been blessed.
And you've been there how many years?
Well, since 1984, so I guess this is year
35?
35, going into 36
Isn't
years.
that something?
In the same location.
Bravo, bravo, bravo.
Yeah, it's been.
Now, were you always an entrepreneur when you were young? You know, a lot of people who are entrepreneurs were always selling stuff when they were younger.
Yes, I always had a little job, you know, with my wagon. I would go around and sell sunflower seeds or plants. You know, I'd go around to the beauty salons and sell like the 10 Commandments on a little glittery board or something like that. And then I had my Michigan Chronicle route and my jet route when I was a kid. So I always like having my own.
She was meant to do this, meant to do this. Well, you brought some beautiful things this morning. I want to get into these hats right here first.
Well, I couldn't bring everything, Brenda.
I know.
But I just wanted to let your viewers
sampling.
know that we have a lot of accessories at Spectacles as well as fashion items, and that's one of the hats that comes in about 4 or 5 different colors.
Yes, it
Very
does.
reasonable, just $25.
Really? This is great for this time of year, too. Mm-hmm. Oh, cool.
Keep that sun off your face. And then another hat.
And people, we talked about healthcare. People with diabetes shouldn't be out in the sun. I mean, this protects their face and stuff like that. Yes.
You gotta be careful with that sun.
Yes.
And then we have our bucket hat.
I
which is-
love the bucket hat.
These are just $10, and I know you said you had a white one when you were coming up.
When I was coming up, I had a white one.
So this is an item where everybody can get into the shopping experience at Spectacles. Doesn't have to cost
It's-
a lot of money, but we try to have things that are affordable
Hey,
and
matching
fashionable.
me today. I love these hats.
And I brought this one to go along with your.
The
This is our
bag.
newest item, is the shopping bag. So I brought this one, and I've got a hat, and I've got a T-shirt, and it'll all be coordinated
Oh, wow.
for you, Brenda.
I love these bags. How
Thank
much
you so
are
much
they?
for. They're just about $20.
Oh,
Something
this
like
is
that.
a great bag. It's big, everybody. Big.
And you can use it, to carry your records, because we're still doing our vinyl night
I
every
know.
Tuesday at Queens in downtown Detroit, right behind the Shinola Hotel.
Now, we've been talking about this, me and some friends, about vinyl. Vinyl is back.
Yeah, it's had a resurgence.
Quite a resurgence.
I had to bring a turntable into the store so that our vinyl customers can have something to play the records on, because
Well,
they want
don't
to
you-
listen to them
Don't
too.
you remember record shops when you were young and you go in and they play the record, so you could hear the record?
Yeah,
Yeah.
that's when the albums were $3.99.
Oh, God.
Those were the days.
Those were the days, my friend. And so, vinyl is coming back.
Vinyl is coming back, but let me just tell you about DJ Scent, because DJ Scent makes these very interesting keys. And these are like, you can just put this in your computer,
Yes.
and on here, she can have up to maybe 8 CDs. These that I brought today have 4 CDs on them, which is like each CD is like 70 minutes. So you're getting something like 280 hours worth of music.
Oh.
And she has them very nicely packaged it. And we
Wow.
carry these at Spectacles for DJ Scent.
Now, you would just put this into your...
These are house music
Right.
keys.
But you'd put them into...
Your computer,
Yeah,
or
that's what I
or
was
your
thinking.
car.
Right, because this is is this USB?
Yeah, that's a
Yeah,
USB.
USB. Oh, wow.
So this,
And
you
can
talk
put it
about
in
the
your car.
vinyl,
Yes.
but then you have technology here.
Technology is
Digital. So a lot of people, they want to keep things very, tight, modest, and this will do it for you. You can listen to
Wow.
music, take that trip to Atlanta, wherever you're going.
This is great.
Yeah, that's
Thi-
very
this
innovative.
Wow, when did this come out? I wonder.
Well, DJ Sen has been doing it for a couple of years, but now she's gotten the packaging down. And DJ Sen is on the radio on
Yes.
98
Yes.
FM.
And so you could buy it and get all this music, and you just plug it into your car. You don't have to worry about a thing.
Yes.
Don't you worry about a thing.
So
Stevie.
also, I just brought some of our icon T-shirts to show you.
Oh, yes.
This one
Can
right
I
here. Yeah.
Yes, okay.
Now this one has Denzel. It's a scene from American Gangster.
I see. He was fine in that movie. Okay.
And this one is a classic from the Paid in Full movie.
Oh, really?
Yeah, and this one is very, very popular for us.
Oh, my God. It has on it,
Well, it says get money, and we all need y'all to
get
get
money.
that.
Get money.
Get some of those
You
ducats.
see that, everybody? Get money. Oh, I love this.
Yeah, this one of our recent companies that we're doing business with now is called Collabro. We have the Icon T-shirt from the Olympics.
1968 Olympics, right?
Right.
And the three guys, the two young men,
Yeah, is his
holding
name
their
Tommy
fists
Smith?
up. Tommy Smith and, I can't think of the other guy. But here's the thing.
Okay.
But I do want to say this. The thing about this, I remembered this very well. I was in college, and the controversy. All they did was hold their fists up like that. Power. The controversy. People wanted to strip them of their medals. It was just so much terrible controversy. All in this, and here they have a president who lies every day, conspires, and so forth. And nothing happens.
It's very interesting to watch the cycle. Because right now, people in my community are really into their culture and their blackness.
I
And
love this shirt. And this
this.
is only a medium?
Check this one out,
This is a
Brenda.
big.
Look,
Okay.
look.
Oh, Lord. Black Panther Party. Wow. That was my afro back in the day.
Mm-hmm.
Yes,
So
beautiful.
I'm showing you these T-shirts because these are what's really selling at Spectacles. This one is a play on the Detroit versus everybody. You know,
Culture versus
versus
vulture. Now, what does that mean?
Well, what is it's kind of like you know, the rights of your culture, and it's just
Yeah,
a play on the
I know what
everybody's saying versus everything.
but
But
I think vulture is the dark side of us or people. I
Mm-hmm.
think vulture is not a positive thing. If we celebrate the culture, that's what's so positive, I think.
Okay,
I mean,
okay,
that's the way
I
I'm
can go for
interpreting.
that. I've had different interpretations.
Yeah, because versus, if we celebrate the culture and who we really are as a people,
Mm-hmm.
things would be much different. So
Mm-hmm.
I
We gotta
love this.
celebrate the arts.
Yes, oh yes, the arts and our culture as a people, the way we communicate with each other. There's so
Mm-hmm.
many things that are part of who we are, and I love this shirt. This is culture versus vulture. Okay, and now
I
who
have
do we
another
have?
icon T-shirt here. This is Lauren Hill. This is the
Lauren
one.
Hill, Miss Hill. Yes.
So we
Oh,
try
this
to
is beautiful.
touch on the
This is
different
beautiful.
icons and things that are related to black people because the store is owned by a black woman. You know?
Absolutely.
So Spectacles will always have
Well,
things.
let's just see what we
And
got.
this one is one of our icon shirts that says, I love black people.
I love black people. Oh wow.
Then
I,
we have I love my hair
oh, I need to get that one.
because we all love our hair.
Yes.
Black women everywhere love their hair. Then we have the what up doe. The what up
I
doe,
mean, what up, though?
which is Detroit slang.
Yes.
And this shirt we do in a couple of colors, navy blue, but we always try to have it in the Tigers colors, even though we're not having the best season, but we're hopeful. We're hopeful.
We've been hopeful for quite a while lately.
And this is again our Soul Detroit, which is these are
Isn't
all
that
our
your
classic
brand?
T-shirts.
That's your brand.
Right.
Uh-huh.
So we always have things, these shirts in stock, and this is a new T-shirt that has to do with hip hop.
Right.
This is a periodic table, and this is
Oh.
about the elements of hip hop. And you see in here you have MC,
Oh, this is great.
DJ, graffiti, b-boy knowledge. So this is very
Wow.
popular right now too.
Wow.
So thanks, Brenda, for
Oh,
letting me just
oh, I
touch
wa-
on a few of the things.
Right, but you got
Oh
other
yeah,
things.
these bracelets.
You know-
Men are wearing a lot of accessories.
I noticed
And
that.
Spectacles is mostly a menswear store, so we try to have accessories for men because now they're getting into wearing more and more jewelry. We have necklaces.
Why do you
ankh
think that
necklaces.
is?
Well, things are just changing now where you can't really differentiate, as far as the sex orientation of a person.
That's a good point.
We're all becoming the same.
There is that point where everybody just converges, and women wear men's stuff, and men wear women's. I mean, not
Yeah,
women that were traditionally. Let's just say traditionally that.
Well, you'll find that men are wearing earrings.
Oh yeah.
we-
Well, my
and,
my son has earrings. I made sure he got earrings.
You made sure.
Yeah.
Oh, okay.
Well, because I just think he's 6'7". I said, have yourself an earring. I always liked a man with
Soft-
an earring.
yeah.
Yeah.
Kind of
yeah.
softens them up. And you notice we do have the D earrings.
Yes, these are.
So again, anything that represents Detroit is really important now and selling. We have people traveling to Spectacles from France, from Australia, from all over the world coming to see what we're doing in Detroit, Michigan. And with all those wonderful hotels that we have downtown, like the Shinola
You
Hotel,
know, and
the Elements
do you
Hotel,
know that
the
the
Siren Hotel.
Foundation
I
Hotel?
was at the Foundation last night.
Really? All right,
Yeah, Malik Austin was performing last night. He and Dave McMurray.
Oh, Dave is a friend of mine. Yeah. This the D, the Old English D. That's what this is.
Right.
And I've seen people wearing these earrings, and we see these, and right away we think Detroit or the Tigers, you know. And
We have so many artists that represent the city that wear the D earring, or maybe they have a D tattoo.
yes, 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 yes. And wait a minute. Because even with the big hats right here, I see women wearing those hats. I see them doing that. And you have different size. She has different sizes of the D earring.
Yeah, they come in about 4 or 5 different sizes. They come acrylic, or these I just brought the wood ones, but you can get them in a variety. They're from I think the name of her company is Selaski's Jewelry.
Is this a local company?
This is a local company.
What about these? Are these local artisans?
These are local artists as well. I got these from a local artist.
These
and
are good
from
beads.
yeah, these are really nice. These run about $15, and over here we have the more expensive ones at 40 and 38
Wow.
and $45.
Wow, these, and you know the thing about these, they never go out of style.
No, but people are wearing, like
The-
five
five
and
and
six
six
of
of
them.
'em, you're right.
Guys will come in, they'll buy one, and then they'll come back and they'll get another one. And every week they're like, "Well, what do you think, Zana? Should I add another one?" And then the wood beads are very popular too.
Yes, yes, very, very popular. And so you have the T-shirts too.
Yeah, but
and,
we sell clothing.
and
We
you
have
sell-
button downs.
Don't you sell some books?
And we have books, vinyl. We just left the Techno Rebel. That was our big seller last month because of the Techno Festival that was
Oh
going on.
yeah.
So we carry the Techno Rebel and a lot of things that are hard to find. Some things are about Detroit icons, like Jeff Mills. We carry.
Oh yeah.
He was a guest editor in a French magazine, so we carry that magazine. And then we carry the DEQ, the Detroit Electronic Quarterly,
Yes.
which always comes with an album and the magazine. John Collins is featured on the cover of the DEQ magazine. It comes out every quarter. So, Spectacles is associated with the DJ culture, so we
Yes, it is.
always know about the underground events that are going on. This weekend, they're having a great big block party
Oh really? Where?
at the Burt's in the Eastern
Oh
Market.
yes.
Then they're having the anniversary party at TV for 3:30.
TV Lounge?
Yeah, that's going on. Then Des Andreas is doing a big party at the Marble Bar with a full band.
Yeah, the Marble
know,
Bar.
And
right
all this
over
is
there
going on Saturday.
on Holden.
Yeah, on Holden. Can you
Yeah,
believe that?
well, I've
it's
been
so
there.
popular now.
It is so popular, and see, right down the street, they're going to be doing that expansion of the Motown Museum.
Right.
It's right down the street. Yeah.
And that's interesting. That's if you don't know how to get to the Marble Bar, you may not get to
I
it.
know.
Because you
I
got to go
know.
behind the Motown Museum.
Right. Or you could come down that little service drive area.
They got it all blocked off.
Oh, they have
There's
it
so
blocked
much-
off now?
Yeah, so much construction. I was there Monday.
Oh,
there
okay,
Monday. But it's
okay.
got a beautiful patio, and all of the patios in downtown Detroit are looking up, because people want to be outside.
They do, and they say that Detroit, we're getting hotels, but we're not getting as many as we need more hotels. They say
Oh,
they
yeah.
are saying that we need more hotels, and even near me, right on the corner. It's not a hotel. It was going to be a hotel on 10 and Woodward. They're building. Have you seen that?
Yeah, I saw that on 10 and
Yeah,
Woodward. That looks good.
Yeah, they're building. It's called the.
That's right by LA Fitness, right?
Yeah, right next to La Fitness, as a friend of mine would say. But now I know about these hats. Where I remember why I used to like these
You were on the
bucket hats.
Buffalo boat?
No, it was Surfside 6. It was a television show back in the day that came on, and Troy Donahue would.
Troy Donahue,
Well, no, he
goodness.
wasn't on Surfside 6. When he was in Summer Place, he'd wear this hat, and I was a Troy Donahue fan.
Oh my goodness.
I know, but I was 12.
Okay.
I mean, there's an excuse now, you know.
But yeah, we have these in an array of colors, and we have other fedoras and
Yes, yes.
and hats that
You know,
men would
because
like.
you gave me one of those. My daughter started wearing it. She started wearing that. These are just
That's
wonderful.
what daughters are for.
Now, do you have a website?
Yes, we do. SpectaclesDetroit.com. Our social media is also Spectacles Detroit. We're on Instagram and Facebook.
Right, right. And can people order from out of the state?
Oh yeah, we ship worldwide. We also have a Soul Detroit site. If you
Oh,
wanna
you
get,
do?
Yeah, if you want to get the Soul Detroit merchandise. Again, we're located
Do you
at.
know? Remember, in fact, I sent. I don't know if it was my grandson or my daughter in. I bought 2 T-shirts. One was Soul Detroit. They were. No, I bought one of these shirts. You know why? Because
Why?
they saw my shirt, and the guy got it from England. I
Oh,
sent
really?
it to England.
You sent it to England?
Yes.
Yeah,
yes.
we ship quite a bit overseas. People overseas are clamoring for anything
Yes,
associated
Detroit.
with Detroit.
Detroit.
You know, we take Detroit for granted, and we take a lot of the talent and the people that are making music for granted. And
Right.
you know, because we get all that good entertainment all the time. You know, we're right here with it. But the people in Europe, they make me really respect. the
Oh, and
artists
they
here.
love the music from here, be it new or vintage. They do. They really love it because several of the DJs, I know several of the DJs in England, they watch my show. And
Is
so
that
this may
right?
be, oh yeah, they get, how did you, he knew it from watching the show.
Okay.
Yes, and he did my shirts from my show. And he sent some shirts over here for my Table Talk show. And it's Neil Duggins. Shout out to Neil Duggins.
Oh,
and,
that is
And
wonderful.
my cap, Table Talk cap,
Uh-huh.
he just wonderful.
Oh.
Yes. So, yeah, they watch my show. They do.
Well, let me invite your viewers to come down, you
Yes.
know, over the next couple of weeks, and they can enjoy a 20% discount if they mention Brenda Perryman
If you mention my name,
for the next 2 weeks.
I'm going to come in and mention my name too. And so that I could get some goods, some items. Thank you so much, Zaina. This is always fun. This is wonderful.
Well, the next time you have me, you know, maybe I can bring a couple of models.
Oh,
It's
that
really
would be great.
The clothing would look better.
Let's
if we
do
could-
this before the summer's out.
Okay.
That's
and
a
I'll bring
promise.
a couple of models.
Yes, we'll do it before
And then we can show some fashion and let people know we're
Yeah.
not just a T-shirt store.
Okay.
Okay.
That's no problem. Well, everybody, gotta go. We have Dr. Michael Williams on next, and you're going to get a lot of great information about how to protect yourself this summer from so many things. Be right back.